Welcome to the Beverly Hills Plastic Surgery Podcast. And I'm realizing as I'm saying this, you should be opening this podcast because this is all about something that you really want to talk about with me today. Of course, Dr. Millicent Rovelo. So shoot.
Welcome to the Beverly Hills Plastic Surgery Podcast.
Boom.
I'm Dr. Millicent Rovelo, and I'm here with my very generous, very gregarious, very lovely co-host, Dr. J. Calvert. How are you?
I'm doing great. My eyes are a little watery though from lunch today because I think you made me eat something that was just way too healthy.
I'm sorry.
Too much kale, too much healthy stuff. It was, you can't do that to me. Like I need my fried chicken or something to go with that salad. It's rough.
But it's Wednesday. So Wednesdays, our clinic schedules overlap. So we were in the office together, and I order my usual lunch of like rabbit food and greens.
Leaves.
Yes. And so because you were there, you also like to pretend that you are on the healthy train. So I'll have whatever you're having. And
not good for me.
As our scribe Kim says, on Wednesdays we eat salads.
It's true. And then Thursday I go to Newport Beach and I undo whatever health, anything that I've gotten out of Wednesday is erased by my choices on Thursdays.
Well, I apologize that you're allergic to your greens.
It's rough. I mean, it's very healthy, but it was actually very tasty. So I'm happy to eat very healthy.
Good.
And speaking of which, we're going to talk about people that need to get smaller and how you do that surgically.
Yes. So this is the non-kale
This is
diet.
after the diet has failed, after you've thrown in the towel on the diet, which, by the way, happens because the skin doesn't come off by magic, does it?
It does not. So the topic of today's podcast is the tummy tuck plus, which is actually a term I learned from my patients. I had a patient come in and say, "Do you do tummy tuck plus?" And I was like, tummy tuck plus what? Tummy tuck plus breast? Tummy tuck plus labiaplasty?
Hang on a second. I think, you know what? Tummy tuck plus, is that what you're saying?
Yes.
Okay, I'm going to really quickly just say that that's the key word then because patients are searching that. Sean, are you getting this? The tummy tuck plus. Okay, our producer's dialed in. That's the name of the episode.
That's the name
it has
of
to be.
Tummy tuck plus. What they mean is tummy tuck plus, like plus size, but like
a plus tummy tuck. Yeah, I get it.
It's a little bit more than the usual tummy tuck. And so usually these patients fall into two categories, which occasionally can overlap. One being my massive weight loss patients. So these are patients that have lost a ton of weight and they have lots and lots and lots of skin that needs to come off. That's sort of one category. And then I have some patients that maybe other surgeons wouldn't do because they still are quite large. Maybe they did have a weight loss surgery, but they haven't really gotten down to a good goal weight. Their BMI is still pretty high, or they're just one of these patients that carry their extra weight in their stomach and have really skinny legs. So they just have a lot of weight, plus minus a lot of extra skin still on them. So these are patients that really fall into this tummy tuck plus category.
Right, and I know exactly what you're talking about because there used to be this sort of like thing, oh, you have to get to this goal weight or this BMI or whatever, and that just isn't realistic for a lot of people, and you just can't make things happen that aren't going to happen. And so these patients want to be contoured, they want to look great, and they can. But you need the surgical skill to do that. And you need to, I think you're right. You need somebody that does tummy tuck plus, which means liposuction. It means a whole host of other approaches to the contouring of the abdomen.
Right. This is not your run-of-the-mill mommy makeover. I had a few kids. I take Pilates. I run every morning, but I have this extra skin tummy tuck. Like this is a whole different ball game. And that's sort of what I wanted to differentiate between the two kinds of tummy tucks. And really what I sort of, let's kind of take them one by one. So let's talk about the massive weight loss patients. These patients also sometimes have problems with extra weight still. They have plateaued in their weight loss journey and they come in and they're not ideal, quote, air quotes, ideal candidates, which is that you're at your goal weight, your BMI is within a normalish range, you're a good candidate. These patients aren't that. They have tried to lose weight and this is just where their body wants to be. And no matter what we say, they're not going to lose any more weight than they already have. This is sort of where they've plateaued. And so you have to appreciate that for the patient. Like, you're eating healthy, you're working out, you're doing everything you can. This is just your weight. So let's work with that. And as long as they are otherwise healthy, have good, medical clearance, their lab work is within normal limits, if they're otherwise in good condition, there is usually an option for them. The exception being if they really, really are still quite obese. And that definition is going to range depending on who you talk to. And for me, it's not a hard and fast number, but anything over the BMI over 35, 38, I have done some 38s, this year, that's pushing it, but doable. So case by case, as you get to those higher levels of BMIs. And the other category being the patients that maybe didn't have weight loss or had weight loss but didn't, lose all their weight, and they just have high BMIs. They may or may not have a lot of skin, but they still have a lot of weight. And the point I want to make here, as we just said, this is not your run-of-the-mill tummy tuck. And I want to talk about why that is.
Yeah, I mean, this is where the mere mortal surgeons sort of fall off the tummy tuck train, and this is where you step in because, again, I'm still, I'm looking for the network that wants to do the show. Big patient, little surgeon.
I'm right here. I'm right here, folks.
you are doing things that are really, incredible before and after results. These patients go from absolutely what I would say are almost like a hopeless situation with their skin and how much extra, fat and tissue is around their abdomen to really looking great. And, they're not going to be, bikini models or anything like that. That's not the goal. The goal is to make them feel great about themselves. Right. And you do. And that's something like I said, I used to do these operations back in the day. I trained in Pittsburgh, and Pittsburgh there's some big people there, and there's a lot of weight loss surgery there. And we did a ton of these operations with Dennis Hurwitz, and now Peter Rubin sort of carries that torch there in Pittsburgh. But out here, I think you're kind of it, and you're doing the job that really is very hard because you're managing so much. A lot of times these patients have diabetes. They have hypertension. They have comorbidities.
Or they had before their weight loss.
Or had. Yeah. But even so, they may have some tail end kind of stuff that you're dealing with. And you still have to do this, first of all, safety first. Mm-hmm. And you have to do it well. And so, I can honestly say that with what I've seen, what you do, it's really incredible. But on top of that, the safety, the track record that you have with it is really amazing.
Yeah, and I think we do have that podcast out there on safety in higher BMI surgeries, which is worth listening to. But when you're looking at these surgeries, it starts from the very beginning, from that preoperative evaluation. Are you a candidate? And if you are, what can we do to make sure you're medically optimized before you go to surgery? And then the type of surgery that we do. So in a traditional cute little mommy makeover tummy tuck, you have that one single incision in the front, kind of from hip to hip, like a little bit of a smile, and you take the skin, you do some liposuction, you do some contouring, and that's it. And you recover for a couple days, a week of some pain medicine and limitations on your positioning and sitting and sleeping. Then after a week, you're moving around, you're walking around okay, and you're back to work, in 2 weeks or so. That's sort of the trajectory of a typical tummy tuck. These patients, their incisions are much bigger. So most of the time, I'm extending these incisions way past the hips, around towards the back, if not going completely circumferentially around the waist, because there's just so much skin that needs to come out. Combined with these extra incisions that go around the waist, sometimes you have to have an incision that goes up and down the center. I do that rarely. It's not my favorite thing to do. But if I'm doing it, it's because you need it. It's because you have that much extra skin that you need a vertical component as well as a horizontal component to your incision.
And that is called the fleur-de-lis.
The fleur-de-lis. It's a very French fancy. My New Orleans fans will appreciate the fleur-de-lis incision. So that's just the skin incisions, which are much larger than a typical tummy tuck. But then what you really have to factor in for a lot of my patients is the amount of liposuction that is done. I mean, liters and liters of liposuction before I even start the tummy tuck case. Most of my patients, I put them down on the operating table on their stomach. I start by doing liposuction of the upper back, of the, back side of their flanks, those kind of muffin top. I get it from the back. And then they're still intubated, they're still asleep. We turn them over onto their backs. So now they're lying on their backs. I do more liposuction from the front, of the sides, at the top of the abdomen. I mean, I suck them out as much as I can to get them really down to a size that I can work with. And the only way I can do that is to debulk and remove all the extra fat. But it's not unusual for me to have a 7:30 a.m. start case, and by the time I'm finished with my liposuction, it's almost noon, and I'm just now starting like the skin, quote, tummy tuck part of the case, that what it's booked for. Like that's how much liposuction is being done in these patients. So that's like an extra 1 or 2 surgeries right there on top of the tummy tuck. So the surgeries are much more involved and much more of a recovery.
Well, but it is it's what it takes.
It's what it takes.
This is, you want to get those results.
You got to do the work. I mean, I really have to gear up for these cases. Like, put my battle suit on. Like today, I'm going in because if you want to, I mean, you gotta do a lot of really literally heavy labor in a lot of these cases, and you just gotta commit to it because it is really hard. So it's not unusual for these cases to take 6.5 hours, 7 hours for what people are like, for a tummy tuck? And that's like a 3-hour case for a lot of people. This is not a tummy tuck.
No.
This is a tummy tuck plus. Tummy tuck plus.
And that plus comes in a lot of different plus sizes too. It's going to be a lot. And you know what though? Good for you for really taking the time and understanding the physiology of the patient who needs this operation and doing them right. It's an art, and it's just an amazing feat, and the satisfaction that your patients get from because I remember doing these body lifts. I did a lot of them. I think it was one of those things that it just kind of fell away from me because I got so involved in facelifts and rhinoplasties and my fitness breast patients like that. That's kind of my podcast would be called the Skinny BBL. That's kind of but yours is like the Tummy Tuck Plus, and every patient needs their surgeon, right? So, it's really I think it's incredible, and there's so much artistry into how to manage all that skin, because you think about it, you're taking this patient and marking them in the morning with all that stuff that you have to suck out. So now you have to have the vision for, okay, this massive fat, this thickness over the abdomen, around the back, I'm reducing that. And then you're marking the skin accordingly so that you can have the options to really tighten them up and get them to heal, which is really key. So I'm totally impressed. I think the results are spectacular. Anybody who's wondering what I'm talking about, all you gotta do is go on Dr. Rovelo's website, look at the before and afters. Not that we sit here and plug our own work, but I think if you're getting these operations done, make sure you do that and look at the before and afters of who you're going to, and make sure you like the contours that you see, because I see a lot of hack jobs around the country. They're just sort of they pass it off as like, well, at least they're smaller. Right. It doesn't matter that the scar is across the middle of their abdomen or whatever. And you know what? As I say all the time, it totally matters. It totally matters. Those scars need to be placed in a aesthetically pleasing position. It matters so much that how can you ignore that? How can you ignore where the scars are and how good they are, or if they don't heal well or whatever? There's a lot to it. So, to the patient who's not coming to Beverly Hills to get this done, look at those before and afters carefully. Look at the before and then look at what the after is, and it should make you go, wow, I want that. Not like, well, that was that patient, they needed that. Because you have to take advantage of every patient's anatomy and make it the best that it can be.
Yeah, I mean that's the whole reason that we're doing this. And I think it's really important for the patients just to know from like an education standpoint, everything we just talked about, the intensity of the surgery and how involved it is and how much extra it really is. It plays into a lot of things. It plays into your recovery. It plays into your expectations of the results, and it plays into the cost. So all of these things, again, not your average tummy tuck. So if you are comparing your experience to someone who didn't have weight loss, was a normal BMI before surgery, your experience is going to be completely different from theirs, and your recovery is going to be much different from theirs. And if you have had a history of weight loss in the past, the results are going to be different. They're still going to be great. But again, the skin you have left behind, not great quality. So it's not going to be as tight as that, little 32-year-old mom who's only ever had a couple kids tummy tuck. She's going to be tight. You're going to be smaller. You're going to be contoured. You're going to look great. But your skin's still going to be loose because no matter how much I take, what's left behind is still going to be loose. So there are some expectation adjustments. And from a recovery standpoint, you're going to be down for the count a little bit longer. You're going to have drains. Sorry, no way around it in these cases. You're going to have drains, and they're going to stay for 2 to 3 weeks. And don't complain to me about the drains because you need them. You really, really do. And they're there for a purpose. And when they come out, hopefully we don't have any issues. It's a much longer recovery because this is a much, much bigger surgery. So if you're going online and you're Googling or you're doing social media searches or even doing website before and afters, and you're just looking at typical tummy tuck results or experiences or recoveries, that's not you. You're in a totally different ballgame. And I do these surgeries so much that it becomes routine, and I forget myself that these are actually still really big surgeries, and it's not one surgery. It's 2 or 3 surgeries in one.
What about the cost? We always try to talk about cost on this podcast because, and just, if people are listening to this, 5 years in the future, just realize that it's going to be more than when we recorded this, in 2023.
Oh, those prices are so cute.
I know. Because, the way inflation's been going, it's going crazy. But, so for me, if I do a mommy makeover where I'm doing breasts and mastopexy, I'm doing a lift and putting in implants and doing a abdominoplasty and some liposuction, for me, that's like a $55,000 to $75,000 range in those operations, depending on how complex it is. If you're doing this tummy tuck plus, where you're doing circumferentials, liposuction, extended abdominoplasty, what's the range in your world?
So in my world, if I'm really doing that extensive of a procedure with the liposuction and all the way around, that is the only procedure I'm doing on the patient that day. I do not like to add breasts or arms or anything else because what I'm doing is already a couple surgeries rolled into one. So if I'm doing this case and it's taken me 6.5, 7 hours to do it, and there is no insurance component to it, you're easily looking at $25,000, $30,000 for that, for just the tummy and the circumferential part of it.
Right.
Sometimes, another topic, sometimes parts of it could be covered by insurance if you're a massive weight loss patient. But what insurance covers is a tenth of what actually needs to be done to fully contour that abdomen.
Yeah, insurance is, they do, with massive weight loss patients, they do cover the paniculectomy, they do cover certain things, but they don't pay a lot of money. So when they say, oh, we'll cover that, it's not they're not really covering the fee. They're paying some amount of money that they've determined is what they're willing to pay on those procedures. And I think patients get very confused when they say, oh, my insurance says they'll cover it. It's well, I'm not in network. I don't have a contract with your insurance, and my fee is X. So that's the problem, is that the reimbursements have gotten so low. Here's a bold prediction for me: the insurance companies will be out of business in the next 5 years, and it'll be a free market kind of world where people get money together and pay for things, and there might be catastrophic, or it'll go to a state kind of run thing.
And that's sort of where it's already headed. Depending on what part of the country you're in, patients are willing to pay, large amounts of money or out-of-pocket fees for whom they consider to be a really good doctor. And that doctor has decided that they are worth more and they're not going to take insurance money because it's not enough for what they do.
Right.
And so they ask the patients to pay for it, and there are plenty of patients that are willing to do that. And I don't know about 5 years, but I think that is where we are potentially headed, to a two-tier society where you have, patients and doctors negotiating their own rates amongst themselves. And then you have, a government-run program where you get good care, decent care, but you might have to wait for it.
Right.
It might not be excellent, but it'll be decent.
Yeah, I mean, the insurance is paying so little. It's
So little.
It's incredible. I mean, they'll pay the hospital. That's sort of the goal, is to make the doctor, I think, the employee of a hospital system, so that they're taken out of the conversation of what these things cost. But from my standpoint, I think that if you're going to want somebody who's the best neurosurgeon to take out your brain tumor, you're going to get out your checkbook, because otherwise you're not getting to them. Insurance is just paying so little.
And it's unfortunate because
so little.
The average doctor didn't really go into this to make money. They did it because they wanted to take great care of people and provide excellent care. And we've gotten to the point where we just can't do that
can't do it.
on the reimbursements from insurances, because you can't even run a practice. Now, granted, full caveat here. We are plastic surgeons.
Don't listen to us.
We're a little bit, we have, the benefit of being able to charge cash fees for things.
Sure.
But for all of our other doctors and surgeons out there who don't have a podcast, I'm going to speak for them for a minute.
We should.
The average doctor who is completely 100% in network with insurance companies cannot run a successful practice on insurance reimbursements alone. That's why they are all being employed by hospitals, because the insurance reimbursements have been dropped so low. It is ridiculous. Medi-Cal will pay $350 for a cleft lip repair to the surgeon.
Oh, really?
Is that better than you thought?
Well, I did one. I did a cleft lip repair at Miller Children's Hospital as when I was a UCI tenure track professor. Right out of my residency, and I got a check for $47.
So we've come up a
for
bit.
a life altering
Surgery.
operation that I did for a 3-month-old baby.
Yeah. $47.
$47.
Well, now it might be $350.
That's pretty good.
And for
$350, wow.
Hernia repairs, inguinal hernia repairs, they get reimbursed.
$200,
a couple $100.
Yeah.
And if you are a private practice surgeon, that's not $450 in your pocket that you're taking home to your wife and kids. That is money to your practice. So out of that $450, you're paying your biller, you're paying your front desk, you're paying your MA, you're paying your malpractice insurance, you're paying your rent. And now you're, $1,000 in debt for that one surgery. So it's unsustainable,
right,
the amount of money that the insurance companies are providing doctors. And I don't know how we digressed onto that, because we were starting out with Tummy Tuck Plus.
Well, because when patients call in, they hear this term, my insurance will cover that. And that's where the disconnect happens. This is why we're having this discussion, because it won't cover it. Yeah. I mean, I don't take insurance anymore, so it's irrelevant to me, because I don't need to argue with insurance companies over $200 on a septoplasty. It's silly.
Yeah.
It just doesn't make any sense to me. But I think for other doctors, when they hear their patients say that's going to cover it, well, there are copays, there's co-insurance, there are out-of-network doctors. Like, don't be so sure that your amazing insurance, that you're paying a ton of money. You're paying so much money for that insurance. And the CEO made $27 million and got options for $75 million over the next 3 years. And the next in lines all got, $7-10 million for running that insurance company. Don't be so sure that they are going to cover the cost of whatever operation you think you're getting for your weight loss surgery.
Yeah.
It is.
Who did you think you were paying that money to? Because it wasn't the doctor.
No, it's definitely not. I mean, the CEOs are fat cats and happy. They have a great deal. I would definitely do that job if they'd give it to me. However, the thing is that the patient is sitting there hearing, oh, we cover that. And that is a loaded soundbite that makes for confusion and disappointment and upset over and over again, especially in the world of plastic surgery. But I think in all types of any kind of medicine, it's really not the proper way to say it. They should say, we pay $200 for that. That's what they should say. They shouldn't say, oh, we'll cover it.
We cover a fraction of it.
They should say, they should say, oh, paniculectomy, we pay $200. Septoplasty, we pay $200. They should say that's what we pay. Oh, you have a $20,000 deductible. We're going to pay $200, but that $200 isn't going to go because it goes towards your $20,000 deductible. So you and your surgeon together can talk about the fact that you're getting no money from the insurance company that you're paying $1,600 a month for. That's all I have to say.
I am on board with that 100%. I talk about this all the time.
How can you not?
And I think we do have to have a dedicated podcast at some point to this topic because I just see it every year getting worse.
Let's bring the CEO of like Cigna in and like have them come and like discuss it with us. That'd be cool.
Yeah, at Cigna, are you listening?
Yeah, come on in. We'd love to have you on. We want to talk all about it.
We have some questions.
You know how that podcast would go. There'd be like body parts in the room afterwards.
Yes.
Just be a smackdown like cage match, like WWE style, which I love. That'd be great.
That'd be great. But in the meantime, so when we're not doing that and solving the world's insurance problems, we would love for you to come in and talk about your Tummy Tuck Plus. I do love doing that, and I really enjoy it, and we can get some excellent results. The patients just need to know that it is a Tummy Tuck Plus, and everything that entails, including recovery, costs, expectations. This is not your run-of-the-mill mommy makeover tummy tuck. It's a big deal. It's a couple surgeries rolled into one, and it's you're gonna go through it, but it'll be really good on the other end.
And you're good at taking care of them all the way through that journey because it is a journey.
Oh yeah. And I think that's pretty much it. So this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.